What does your MRI mean? Are you screwed?
Just got a full body MRI done, and apparently I have a bunch of bulging discs.
Multi-level disc herniations of the lumbar spine encroaching mildly on the respective anterior epidural spaces. There is as well facet arthritis posterior inferiorly. The need for dedicated diagnostic lumbar spine evaluation follow-up to be determined after discussion with your doctor. That doesn't sound good. And that was only finding number 3 of 6. I'm Dr. Sean Pastuch, the founder of Active Life, and for decades, people have sent me their MRI results afraid that they're never going to be able to do what they were doing in the past again, especially high-level athletes, like this one. You're on this video because you got an MRI, or you're thinking about getting an MRI, and you want to make sure that you understand the findings without freaking out.
Keep our composure!
You want to know, am I now not able to do the things I once loved to do, or is this totally normal? We're going to go through all of it. As you can see, I pulled my computer in here because I have Kristine's MRI report written out, and I want to go through it with you line by line. What we're going to do is we're going to take the terms that you're going to read in the MRI report, and I'm going to break down what they mean so that you can start to understand things much more simply. The first thing that you need to know is that there are 4 different types of disc herniations. And the reason why that's so important is because based on the type of disc herniation that you have, the likelihood that it self-resolves changes. What might be surprising to you is that according to this study, the more severe your herniation, the more likely it is to self-resolve. Now, that doesn't mean that non-severe disc herniations aren't painful or that they won't self-resolve. It's just that you might see something and think, oh my God, that's obviously going to need a surgery, when the reality is probably not. The 4 types of disc herniation are sequestration, extrusion, protrusion, and herniation. A sequestration means that the part of the disc that came out has disconnected from the rest of the disc altogether. It means it burst through the outer layer and it's floating around. An extrusion means that it's burst through the outer layer, but it's still connected to the inner layer. A protrusion means that it's really started to push through the outer layer so much that it's deformed the outer layer, but it's all still connected and the outer layer hasn't torn completely. A bulge means that the inner part of the disc, called the nucleus, has pressed into the outer layer, called the annulus, and it's deformed the shape, but it hasn't broken it, and it hasn't seeped into that area at all. Now let's dive into Kristine's finding and specifically break down each term. It says she has multi-level disc herniations of her lumbar spine. Now it doesn't say what kind of a herniation it is. It doesn't say if it's a sequestration, an extrusion, a protrusion, or a bulge. But judging by this image, which is of her lumbar spine, it's most likely that what she's looking at is a bulge, which is the least severe of all 4 different types of disc herniations, and also, according to that study we talked about earlier, the least likely to self-resolve. Now, as you heard from Kristine in the video from earlier, she's not in any pain. And so the question that she has is, what does this mean? Is there something that I need to do about this? Is this going to be a problem for me long term? And we'll get to that later in the video. But what's important for you to know is that she has these findings, which means that you might also have these findings, but you might have pain, which is what led you to getting the MRI. And so you might think that that pain is coming from that disc, but the reality is a lot of people have these kinds of disc herniations without any symptoms at all, which means that you having the pain and the disc herniation is not necessarily indicative that the disc herniation is what's causing the pain. I hope that that was clear. Here's a study that you can look at that will demonstrate that for you. Let's keep moving on to the terminology in her MRI. There is as well facet arthritis posterior inferiorly. Let's break down what posterior inferior means. Posterior inferiorly means it's on the back side of the disc towards the bottom. Pretty straightforward. Inferior is the bottom, posterior is the back. Anterior is the front, superior is the top. Now, when they're giving you terminology like that, describing where it is, they're talking about where it is relative to a single structure that they're talking about. In this case, the facet, which leads you to asking, what's a facet? A facet is where 2 spinal bones are going to touch each other or articulate with one another. It's where they interact. In your cervical spine, which is your neck, the facet joints are aligned top and bottom so that you can rotate. In your thoracic spine, which is your mid-back, the facet joints are aligned front and back so that you can laterally flex. In your lumbar spine, which is your low back, they're aligned like this, so you can bend forward and bend backwards. Arthritis is an inflammatory condition in and around the bone. So it can lead to extra bone growth that can be temporary, or it could be permanent, looking like things like bone spurs or additional growths on a bone that have solidified over a long period of time, especially in the cases of inflammatory diseases. But we're not going to dive down that rabbit hole today. Just know that in the case of Kristine's MRI, facet arthritis means inflammation around the joint. Arthro is joint, itis is inflammation. If I was still a practicing chiropractor and Kristine came to me as a patient, the treatment for something like what she's experiencing right now would be nothing.
You get nothing.
There is nothing that I would do to Kristine's condition to make her feel better. Why? Because she's feeling great. She doesn't have any pain. She doesn't have any symptoms. We would look at optimizing her, that's for sure. We would look at optimization, but there's no need for her to come in for treatment for a problem that doesn't exist. There is no likelihood that this is going to go from what it is now to something more severe that is going to cause her discomfort in the future. There is no reason to intervene right now and change her life if she's enjoying the way that her life is going. If she's feeling physically fit, she can continue doing her exercise program. There is nothing that has to change for Kristine. And if you have results that are similar to her, there is probably nothing that needs to change for you either.
That's a relief.
These are normal variants that we find on x-rays, that we find on MRIs. They're not something to worry about unless they're coupled with a bunch of other stuff. And if Kristine's doctors were worried it was coupled with a bunch of other stuff, they would have told her we have to intervene here. She called me because we have a great history and she still trusts me. If you've been diagnosed with a herniated disc in your low back and you want to be put at ease, let me help you. This study right here shows that less than 15% of people with low back pain can have it attributed to their disc injuries. What that means is that the low back pain that you're feeling is probably not coming from a disc. Now you might be saying to yourself, well, I had an MRI and I have a disc herniation and I have the pain. Is it possible that the reason why less than 15% of people have low back pain as a result of herniated discs is because they don't have herniated discs? Well, this study shows that of normal people without symptoms at all, when MRI'd, 30% of them will have an active disc herniation of some sort. That doesn't even account for the people who've had herniations in the past that have resolved and no longer exist for them. So no, the likelihood is everybody experiences disc herniation, everybody being a little bit of hyperbole, but most people experience disc herniation and few people experience discomfort as a result of it. Might you be one of the people who is experiencing discomfort from your herniated disc? Absolutely. Does that mean that you need to go into a panic? Definitely not. Another interesting finding on Kristine's MRI that we're not going to dive into is that they found signal changes, which means that there's some flags going up on the MRI in her shoulders that might be related to a post-surgical condition, but they want to check on that for historical reference so that they can have it in their records. That's interesting because one of the things that Kristine did very publicly back in the teens was tear both of her shoulders on the floor at the CrossFit Games regionals. And that's one of the things that she came to me for, was post-surgical rehab of her shoulders when I was still in practice. And so good job to her doctor making that repair. It goes to show you how an MRI can find a lot of stuff, but it doesn't necessarily account for everything that's going on in your life. Kristine objectively had 2 surgeries on each of her shoulders, and the MRI says maybe she had a surgery on one or on the other. That means the surgeon did a good job. It means she did a good job rehabbing it. And it means that the MRI never tells a full story. Remember, terms on an MRI report can be scary, especially if you're not a doctor. It's no different than receiving a letter from a lawyer and being like, oh my God, do I need to hire a lawyer? It can get your blood pressure up, it can make you nervous, but most of the time a quick Google search or a message to somebody like me can answer your questions about what it is that your MRI is saying and then give you better information to go back to your doctor with so that you can feel safe, clear, and empowered to continue living your life the way that you enjoy it. I'm Dr. Sean Pastuch. Remember that you can live more and hurt less. Chronic pain is a choice. This video is over. Oh yeah, like and subscribe. Now the video is over.